Well, good afternoon. This is Lucinda Nord with Indiana Association of United Ways, and we welcome you to our Indiana Human Services. Oh my gosh, the slide says intro to the 24th session. This is actually our legislative wrap-up session, and we do this in conjunction with the Indiana Coalition for Human Services, a statewide coalition of service providers and advocates throughout the state, the Indiana Nonprofit Resource Network, which is your nonprofit training service of the Indiana Association of United Ways, and then myself from Indiana Association of United Ways. I am joined in this session by my colleague, Mark St. John, who is helps co-chair the Government Affairs Committee of the Indiana Coalition for Human Services. And you can see down there below we also have David Sklar, who sometimes helps out, and Mark is also a lobbyist for several clients, and including one of our ICHS members, the Indiana Association for Community Economic Development, or IACED. So let's begin. Mark, do you want to just give us a quick introduction to the State House this year and where ICHS started?
Certainly. This, as you all should know, is the short session. Happens in an even number of years. With supermajority for the Republicans in both chambers, and there were 3 new members that replaced people that had moved on and a couple of cases that passed. Next slide. There were a variety of hot issues this legislative session. The House Joint Resolution 3, the marriage amendment, kind of took the air out of the room more than the first half of the session. Consequently, later on, things seem to get pushed together. A lot of discussion because of the governor's initiatives about early education and pre-kindergarten, issues about the business personal property tax, discussion about the Affordable Care Act, adoption promotion, and more issues around K through 12 education. This is real quick was the governor's priorities. I won't take a lot of time to go through them, but you do have them there for your reference. So let's move to the next one. The Coalition of Human Services focused on 6 areas, and then we're going to go through these in more detail, but related about health care with choice and drug testing, Healthy Hoosiers, working families, workforce-ready graduates, some accountability issues, and about how do we help make thriving Hoosier communities. Lucinda, I think this is you at this point here now.
Okay. Well, the coalition and many of our human service partners followed a lot of healthcare bills. Unfortunately, there weren't a lot of discussions around the Affordable Care Act, but there were a lot of specific issues that related to health care. So you probably read in your local papers about the tanning bed restrictions for minors. There was a lot of discussion around opioid treatment. That's dealing with the methadone and the painkiller addiction that we have. Probably most important for our coalition members is the CHOICE program, which is the community living program that allows older adults and people with disabilities to stay in their home rather than to go into nursing homes. And that bill originally was a little bit broader than what it ended up being. It ended up expanding the pilot that was started up in South Bend and then down in the southeastern corner of the state through Lifetime Resources, expanded the number of counties, and then requires some additional FSSA reporting. If you have any questions about any of these specific bills that are listed here, feel free to ask. We may not have expertise on all of them, but we can certainly do some research. Another that will affect a number of folks around the state that you'll be seeing locally is the concussion bill that really deals with high school athletics. It does not extend to, say, after-school programs or other kinds of recreational programs, but there is an ongoing conversation about that. So human service providers that do that after-school work or summer work should pay attention. So what didn't happen, we did not see any bills related to the expansion of Medicaid or the state-based exchange actually being heard in committee. There were bills drafted. There was some strong interest on a part of a number of both Democrat and Republican legislators, but they did not go any further. There's still an ongoing conversation about whether Sudafed should be by prescription or should it be additionally regulated because of the meth issue. I know a lot of our senior advocates were really interested in the tax credit for caregiver bill. That did not get a hearing, and you may have read very recently about the nursing home moratorium, in that for this past several years we've had a moratorium that doesn't allow additional expansion of nursing homes, and that moratorium was lifted basically in the final hours. Probably what's most interesting for a lot of our members throughout the state would be the drug testing for welfare benefits, in that bill started very broad in the House. This is something that the Indiana Coalition for Human Services and many of its partners have been very active in. It was expanded to include language around SNAP benefits and nutritional choices around SNAP. When it moved over to the Senate, it was highly amended and scaled back to remove those SNAP provisions and to remove most of the drug testing provisions except for those who had prior convictions. Then during the conference committee process, the bill got expanded again, passed the House, and then from the Senate, it actually died in the Senate due to a lack of constitutional majority because it had a 24-24 tie. So that was a very interesting bill. I think we're going to see that bill back again, and it is something that the Coalition for Human Services is interested in, both from each of our members in this coalition. I just want to talk a little bit about this bill because we know a number of you around the state have interest in it. This bill has a number of concerns. One is from the mental health community and the disability community. There's really a rights issue because it is selected, the way that the drug testing was selecting people who would be predisposed to an addiction really calls into a question about is that a fair way and is that an appropriate assessment tool? So there are some constitutional issues there. From those who have a fiscal concern, there's a real concern that the program would have cost more than what it would have actually saved, because what we know from the statistics on TANF recipients is that the number has really decreased to the point that there are only 6,000 adults now in the state on TANF. And then there are some other concerns around, is this really being fair to the most impoverished, most vulnerable Hoosiers? So if you have questions about this particular bill, we can certainly prepare some additional information. You can look at the Indiana Coalition for Human Services website. We know that there's a lot of interest in that particular bill. It will probably be back next year. And then finally, on the healthcare area, we just want to give you a quick update about the Affordable Care Act implementation. Since it was passed in 2010, we're now in the fourth year, and this is the big year because of the open enrollment into the marketplace. We are participating as a state in the federally facilitated exchange, or commonly called the marketplace, and that provides subsidies and tax credits for those who have incomes between 100 and 400% of poverty. The deadline, as you've probably heard in the media almost every day for the last couple weeks, the deadline is fast approaching, in that folks have to enroll in the marketplace by March 31st in order to not endure a penalty on their taxes next year. In the process, Those who have incomes below 100% of poverty may be eligible for Medicaid or they may be eligible for HIP, but there is sort of a coverage gap for those who have incomes between 24 and 100% of poverty. So know that there are ongoing negotiations between Governor Pence and HHS Director Kathleen Sebelius. They met in February and they continue to have negotiations. At the same time, the state FSSA and Office of Medicaid Policy and Planning are having hearings about a number of the other changes related to implementation. So for example, the wait list for HIP, the Healthy Indiana Plan, has been lifted and they're going through the official rulemaking process. That hearing was last Friday. There is another hearing this Friday, tomorrow, the 21st, on the transition plan. There's a lot of attention right now on how do folks who are dual eligibles or folks on SSI who will have a different type of Medicaid rather than Medicaid spend down, how those folks are going to be transitioned, how the folks who are currently on HIP are going to be transitioned to the marketplace. So there's a lot of fluidity in folks' coverage in whatever type of plan they might be eligible for. There's a lot of experts around the state, and we encourage everyone to make sure that all of your clients have access to information about how they should get enrolled so that they don't have to have a penalty. So let's change gears and talk a little bit about working Hoosiers.
So there were several bills that affected working folks that were dealt with in the legislative session. One was relates to unemployment benefits, House Enrolled Act 1346. Which kind of lowered the burden of proof on employers and changed the drug testing provisions for people to receive unemployment benefits. A second issue in central Indiana was the issue around mass transit, Senate Enrolled Act 176. This is the bill that allows the Marion County and the surrounding counties or townships to vote about whether they're willing to help pay for an expansion of public transit. This is the third year this issue's been before the legislature, and it finally passed this year with some restrictions about light rail and such. This could be a precedent-setting issue for public transportation funding in other parts of the state. For people who are teachers or who are public employees, there were some changes that happened this year to the Public Employment Retirement Fund and the Teacher Retirement Fund. It relates to the annuities portion of the benefits. The state had proposed to privatize this thing, and a bill was passed through the legislature that restricts it for 2 3/4 years from being privatized, and it does reduce the benefits, the payout for that, from 7.5% to the 4.5% of the prevailing market rate. It's stair-stepped over 2 years. Many of you work with clients or acquaintances who have been able to benefit from the state's earned income tax credit. There was a discussion in the legislature in several different bills about creating a sunset for the earned income tax credit and a variety of other tax credits. All of those sunsets were successfully eliminated this year. They're all going to be studied in greater depth over the next 5 years, but without the threat of a sunset. The earned income tax credit, like other credits, has to prove its worthwhileness, but it's not an automatic death sentence for it. One other bill that related is House Enrolled Act 1380. This bill requires FSSA to look at and study on the benefits to individuals whose income does not exceed 200% of the federal poverty level. This is, I would suggest, a piece of concern that some legislators have had, that benefits and stuff are keeping people from working, and that we've created a society of dependence, as some people might say. And so this requires FSSA to look at a variety of the benefits and report back to the legislature about what those benefits are and who uses those benefits.
All right, I'm going to move on to some early care and education. There was a lot of attention to pre-K and to quality child care this year, and we are so pleased to announce that the House bill is something that we worked on through United Way very closely, the House Enrolled Act 1036, which is the bill that would require all child care providers who accept the federal CCDF, or Child Care Development Fund, to meet certain requirements, such as child-to-staff ratios, group sizes, 12 hours of training for caregivers, and nutrition and daily requirements. The bill also does some other provisions, like requires death and injury reporting, and opens the immunization registry to licensed homes and registered ministries. So we're very excited about that. Most of those provisions do not go into effect, though, until 2015, which gives child care providers a long time to be able to adapt their models. Probably what's getting more attention is the pre-K pilot program that looks at increasing the number of 4- and 5-year-olds in about 5 counties into a pre-K program. How that is going to be administered yet, I know I'm getting lots of questions about how can I get my county as part of that project, and how does it going to look. We're not sure yet. There's still a lot of details to be worked out because of those sort of final hour negotiations. So more to come on the pre-K pilot, and it's going to be studied as well, really looking at what are the most effective ways that Indiana can build a pre-K program that has a mixed delivery model in both private community-based types of programs as well as school-based programs. There were 2 other bills that were probably a little more minor. One relieves property taxes for some for-profit providers that meet the high level on paths to quality of level 3 or level 4, and another allows it deals with how if a school system wants to have a referendum around pre-K, how they can create that language. There were lots of other activities around the education area, and I'll let Mark talk about a couple of them, and then if need be, I'll jump in.
There has been this ongoing discussion in Indiana and in other states about the federal Common Core standards. Last year, the legislature paused those Common Core standards, and now they are requiring the legislature or the Department of Education to write new standards. There's also a bill, Senate Bill 91, that defines college and career readiness. Again, both of these efforts are how do we create folks that are ready to go to work as soon as they graduate from college or high school or go to college. Discussion about teacher qualifications, some tweaking there, looking at school discipline studies. There is a new program that will allow for loan repayment for teachers with science and technical kinds of degrees. They've enabled some stuff about adult high school schools and how they work and dropout stuff. There was some loosening of requirements for child labor. A lot of this was driven by people who had concerns that are self-employed that wanted to be able to use their children at work. the one that probably created the most controversy was the gun bill, Senate Roll Act 229. It started out as some restrictions on the ability of schools or local police departments to buy back guns. Along the way, in the House, they put into this bill a bill that says, or language that says that it is legal to bring a gun to a school parking lot as long as it's kept in the car and locked up. This was quite controversial, and ultimately, though, did pass both chambers of the legislature. It really gets into a discussion about school safety and how that affects both children in schools and employees at schools.
Yes, and in addition, there was that ignited a conversation about what constitutes a school, and does it include the non-school time? So if a school is rented out, for example, for other activities, does that also count or not? Or if a school group goes to another location, does that constitute a school? So we anticipate that there will be ongoing conversation about that bill as it is implemented. It was largely opposed by many of the school groups throughout the state.
Very contentious. Very
contentious. So along the lines of kids, let's talk a little bit about some of the child services bills. The big bill that a lot of the adoption and foster care advocates were hoping would be for the restoration of the adoption subsidies, which did not happen. However, the adoption tax credit and the expansion of the fictive family, which really allows, if a child is about to be removed from parents, but maybe there's an auntie who doesn't have an actual biological or through marriage kind of relationship, maybe a best friend of a mother or something, it allows those other relatives to take custody. There was also a lot of discussion, and you'll see this later in a study as well, about when a parent's rights can be terminated to allow an adoption to occur. So those bills did get a lot of attention in the child service community. What didn't really happen that we expected, there was some conversation, a lot of conversation. The in-state tuition for Dreamers bill did not get passed. There was an effort to have teacher choice, where teachers could be rewarded for transferring to low-performing schools. That was one of the priorities. That did not necessarily happen in the way that it was anticipated. And while the cursive writing bill passed the Senate, it did not get a hearing in the House. So those are things that were sort of on the front page but didn't quite make it through the Education Committee process.
There were several bills that relate to things that we can help with local communities that were considered by the legislature. Some good, some bad. One was the Senate Bill 340, the Energize Indiana program by energy efficiency. This started out in the Senate as a bill to allow some large manufacturing groups to be able to opt out of the demand-side management program to save them money at this point. The people that are everybody, both industry and in residential, commercial places, are charged a small fee that pays for the program. And the concept is that in the long run that will, they can do things that will save money. The large industrials asked for an opt-out, which the Senate passed, but while it was in the House, kind of out of the blue, the whole program was eliminated. That was agreed to back in the Senate when they concurred with the changes made in the House, and it's now before the governor. There are a number of people that are currently working in the governor's office about vetoing that bill. concerns that have been raised by several legislators about drones and cameras and surveillance stuff, electronic monitoring. That has been specified that there has to be a warrant done by the police folks before any kind of electronic surveillance can be done. This is kind of a long run about the state, but they have established a commission for redistricting of legislative districts. This has been a discussion for several years, and the party that's out has always wanted to have a redistricting commission, but the party that's been in says, oh, there's nothing wrong with it. For the first time, they've established a commission to look at this about some kind of a fairer way to draw legislative district boundaries. So we'll see what happens. There was also a bill that Senate Enrolled Act 106 that deals with local government fiscal transparency, increases the requirements about information that has to be available to the public and on the web about finances of all local units of government. House Enrolled Act 1005 was a bill that looked at a wide range of state laws, and the intent was to eliminate unnecessary activities and boards and clear up some conflicting language about some activities. The last bill on this was criminal code reform. Many of you have been aware that the Criminal Code Commission has been working on this for several years. They've added to the number of different classes of crimes, what they are, what the sentencing was, and this session they dealt with some minimum sentences for violent crimes, and it's worthwhile. This is something that both prosecutors and public defenders got engaged with, and both sides came through with something here that seems to be significant.
There were a number of issues that didn't happen that were on a number of our members' priority lists. The one thing that we're happy that didn't happen is, as Mark mentioned earlier, a number of key tax credit provisions were set to expire. And we, with a number of our business friends who also would have had their economic development tax credits sunset, successfully got those out of the bills. I don't know, Mark, if you want to mention any of these others and the likelihood of future.
There's been an ongoing discussion about land banking and how do we deal with abandoned and foreclosed properties. And while the land banking, more comprehensive approach did not pass, there was legislation that passed this year that gives local units of government more authority about dealing with abandoned properties. Nuclear energy came up in the discussion, and that didn't go anywhere. The same way with the idea of the study of the economic development vitality of communities did not move forward.
And just as a point of reference, if you have followed or attended any of our prior sessions, we did not list every bill that did not pass. If you wanted to look at our February webinar and slides, we did have a number of the bills specified that had already died from the first chamber to the second. So just as a point of clarification, we're not listing every bill that didn't make it because there were hundreds of them. So let's talk a little bit about those tax credits and the interim study committees. Senate Enrolled Act 80 consolidates a number of the study committees, which was initially very concerning to a number of our human service advocates because a number of the special committees like the Commission on Autism and the Committee on Child Care and the Mental Health and Addictions and a number of very specialized kind of committees that deal with a special population or a special issue were all consolidated into the Human Services Committee. or into some of the other committees like the Health and Behavioral Health Services Committee. I think all in all, it actually is going to put more legislators in front of some of these key issues, and the way that they amended the bill in the final hours was to allow for each of the committees to create subcommittees about special topics. So we may see some of those special population or special topics issues be addressed by subcommittees. So we will know more about how the interim study committee process will work probably around May, the middle of May, when the Legislative Council appoints its summer study. And then House Enrolled Act 1020 does outline a format for studying the tax credits as Mark mentioned before, over about a 5-year period. It hasn't been developed yet, but the Legislative Service Agency will look at a number of factors, including things like how many people apply for, what is the intention of the credit, how many people apply for the credit, how many people actually use the credit or receive the credit, what's the total value of the credit, and is it achieving the intended purpose. So we have grouped these credits according to like purposes, and that's how we have, from a United Way perspective, we have certainly argued that we would like to see the credits evaluated against similar credits so that we don't have a credit that's really designed to help low-income seniors or savers be compared with, say, an economic development credit. We really would like to see the savings credits evaluated similarly, those that help the low-income folks, those that help encourage charitable giving, really evaluated in a similar kind of way. And that we will see over the next couple of years how those get evaluated.
To the best of our knowledge, that study covers all existing tax credits supplied by the state. Doesn't deal with things like deductions, but it does deal with credits.
Right, but interestingly enough, the Enrolled Act does mention deductions and every other way of incentivizing a behavior with a tax incentive. So we will see if they are as comprehensive.
Yes.
Our Indiana Association of United Ways policy update, our last issue, actually included a summary, which was a 2-page list of all of the tax credits that were studied over the 2012-2013 years. So let's go over a couple of the other tax changes. There were a number of tax bills, and in the final week of the session, certain elements were moving from one to another or maybe being modified and included in multiple bills. So just as a sort of a top-line message, what you're hearing in the media is that the legislature did respond to the business request of trying to make this a more business-friendly climate in Indiana by lowering the corporate tax rate, lowering the financial institutions tax, and providing some other provisions, particularly the business personal property tax. So there were a lot of different proposals about how that might be done, and what they did was essentially kick it to the local government to say, local governments, you have some options about how you would like to do that. They also established a Blue Ribbon Commission to really look at what is the impact, because legislators heard from local governments and from schools and even township trustees about what kind of impact taking $1 billion out of their revenues would do to their local services. So there will be a commission that will study the concept of business taxation and probably what kind of impacts that has on local governments. Just a special note, because this happened during the legislative session, they did in Senate Enrolled Act 1 and create a special tax credit for propane sales, though I think the propane sales folks will tell you that it's fairly complicated to be able to claim it, and it really just provides a credit on sales tax paid on propane. So it may only be $25, $35 for a residential customer. But on the flip side, that's $25 or $35 that could provide some savings. Senate Enrolled Act 367 had just a potpourri of provisions. I'm not going to read them to you, largely dealing with local government issues.
Potpourri is one of my favorite words, by the way.
Potpourri, yes. House 1020 we told you about a little bit already in terms of, I actually lifted the language. It is intended to provide a comprehensive review of state and local tax incentives. So they might also be looking at TIFs, defined as exemption, deduction, credit, preferential rates, or other tax benefits that are intended to alter, reward, or subsidize a particular action or behavior. And that's why we really want to push to say, look at those based on their intended effect, because it's really unfair to compare, say, the cost of the Earned Income Tax Credit that benefits nearly 500,000 Hoosiers and their families to, say, an economic development credit that may only be 15 million but only benefits 100 employers. So we'd like them to be evaluated similarly. House Enrolled Act 1266 had some very specific local government finance issues and how to deal with the Department of Local Government and Finance. That's a state agency that deals with local offices. And then House Enrolled Act 1380 again was sort of a hodgepodge omnibus bill that had a number of different provisions, including a repeal of some outdated tax credits, as well as that provision we discussed earlier about the FSSA study of benefits provided to low-income folks. So speaking of studies, we have tried to list here the variety of studies that were encouraged by the either resolutions or included in other bills. So generally speaking, if a bill is going to die but there's still a lot of interest in that particular bill, legislators will ask for it to be studied during this interim or during the summer. And you see that some of those issues like the Core 40 diploma, digital privacy, dealing with those surveillance issues, tax issues, work sharing, which is a hot topic for many of our friends that deal with low-income folks who, especially in certain industries where they lay off employees. We had both from the House and the Senate an interest in looking at a review of criminal background checks. We know that we've heard this. Actually, this came up through some of our ICHS regional meetings, where local agencies were telling us, and we communicated to legislators, that folks were in agencies, if they got two different types of funding, were being required to go through two different, employees were being required to go through two different types of criminal background checks and having to pay those fees, even though it went to the same state agency or two different departments within the state of Indiana. So there will be maybe a review about that. You can see the whole list of possible study topics that might be considered that were recommended by the Senate. I think I have two lists here of the next two slides. All deal with topics that were of interest. And so if you have an interest in one of those topics, or if you have an area of expertise that you could offer in one of those areas that's listed on these three slides, we really recommend that you contact your legislator and let them know that you have some expertise and you want to be kept abreast of whether or not that topic will be studied. And you're welcome to talk to us as well through the coalition or IAUW to find out if it is going to be studied and how you might play a role or provide information. We'd like to remind you that we have our Guide to Safety Net programs. We have provided this through some of our face-to-face meetings, as well as it's posted on the ICHS website. If you would like it in the booklet form, just let me know, and we can find a way to get a copy or more to you. We would love for you to consider joining ICHS as a member so that this is one of those member benefits. What's new in this year's edition is that it provides a poverty chart. And what it does is it actually goes through a list of some of the primary government programs, telling you a little bit about how SNAP or TANF or unemployment work, who is eligible, what is the typical benefit, and how many people actually receive it. So actually it was this document that helped educate some of the members of the Senate about how few people are actually receiving TANF when they were debating the drug testing bill. So now that session is adjourned, what we really want to encourage you to do is, first of all, if you have a legislator, House member, or a Senate member who did something that you really like, it is time to let them know that. It is really important to thank them for their service, even if you don't necessarily agree with all of their the positions that they took, but we really encourage you to thank your legislators. You can check the roll call vote by going to the website, and if you're not sure how to do that, you can feel free to give us a call or email, and we can walk you through that. We know that many of you out there are doing the good work of maintaining your human service providers programs, and you're just working with clients on a day-to-day basis, so you don't live, eat, sleep, and breathe this like some of us do. But we'd be happy to let you know, how did your legislator fare in a particular topic. This is a time that your board members might consider writing a guest editorial or a letter to the editor explaining your appreciation for example, how legislators worked in early care and education or advanced pre-K or whatever your issue is. It's also time to educate your board staff and volunteers, because they need to understand that this policy work that's happening in the State House and at the federal level does have a direct impact on your clients. So, if you run a program in a school, that the gun bill that will offer guns on school property may be of interest to your board. If you have someone who is a state employee or a teacher who participates in the public pension program, there were changes made that will certainly have an impact. So it's time for you to educate your board volunteers and staff about just the facts of what's actually happening in our State House. You can certainly host a local tour or a session to talk about an issue. And again, if you have a particular expertise in one of those areas that's going to be studied, or if your program relies on state funding, because next year is a budget year, now is the time to really start thinking about, how do I build that relationship with my legislators, and how do I educate them about the importance of my program in our community. I do want to offer a special note that this is an election year, so campaigns are going to really gear up over the summer, and you have to be very cautious about what kinds of activities you do with legislators. And we do have a special, how to keep your nonprofit safe and in line with all of the laws and the rules around campaign season. So just as a general note, you're not allowed to do anything that supports or opposes a candidate or a party, but you are certainly allowed to engage your legislator in conversation about the needs of your community. That you're absolutely allowed to do. Also, this is the time that rulemaking about laws that were just passed might be happening. So we talked earlier about two of the areas in the healthcare that have active rulemaking right now. We anticipate that there might be a little some other rulemaking, although not as much as usual, because there is a moratorium on rulemaking. The state, one of the governor's priorities is to limit the amount of rulemaking that occurs in the state, with priorities being those that really have to be done or those that are required by federal funding. And then we encourage you to prepare for 2015. Consider joining the coalition. It's a great way to stay informed and to be a part of a network of other similarly focused human service providers. There will be candidate forums this summer and this fall where you could go and learn about who is running in your district, get to know them, learn their positions, and maybe educate them about your services. It's really the opportunity to get to know your legislator. You can also monitor those study committees and reports, and then Mark, I'm going to ask you, I put a couple bullets here about just sort of reading the tea leaves for what we might anticipate in 2015. We know tax issues are going to be a hot topic because there's been a lot of attention on tax issues of what's the right kind of taxing structure for the state and how do we make sure that it's an active business climate. 2015 is a budget year, so I'm interested in Mark's comments here about the budget, and then what becomes priority may depend on what the outcome of the elections. But Mark, what's your take on sort of reading
the issue about the budget and resources is very, very important. This last December, they revised the state revenue forecast for the remainder of this state fiscal year, and for 3 months in a row, they haven't even met those revenue forecasts. So while we're also giving some tax cuts that kick in here in the future, current revenues are not meeting expectations. So I would anticipate that that's going to continue to be a big issue. And that may drive anything about lowered taxes, etc. There were certainly some things that came up this session that are going to rear their head again. One is the sufficient resources for local government. Another is the issue about funding for routine road and highway maintenance and upkeep. They've stolen, perhaps. They've gotten into Major Moves money, which you'll recall came from the 75-year leasing of the toll road, and they're allocating a portion of that to current state highway activities. They've kind of like cleaning out the cupboard. There may not be much left to go to here in the future. So I would anticipate that that will be the biggest driver for this next legislative session, and everything else will fall out from that.
Yep, I agree. We do have a question about candidate forums. We received a question. Feel free to type in if you have a question. Will we forward the dates, times, and locations of candidate forums? That's a great question. As some of you know, the Indiana Association of United Ways works really hard during the legislative session to post a master calendar of third house sessions, or the meet your legislator meetings. In the past, during election years, we do try to promote candidate forums when we are aware of them. In many communities, a candidate forum will be sponsored by a group like the League of Women Voters or the Chamber of Commerce, or another local civic group where they will invite all of the candidates in, which is one of the rules of candidate forums, is that you must invite all of them. If you're going to ask questions, you can't give preferential treatment. And we certainly, what we did, what the Coalition for Human Services did, I need to explain which we I mean. What the coalition did 2 years ago was we actually promoted the candidate dates and also provided some data about human services and the budget and where human services falls in the budget, so that you can ask appropriate questions related to the human service area. So we will try to do that. It may come through the ICHS newsletter. That's why we encourage you to get on that, or through the United Way policy update. The policy update is issued on first, third, and fifth Fridays of the month. So it is a little bit more regular than the Coalition for Human Services newsletter. Tends to be very regular during the legislative session, and then a little bit more sporadic outside of the session time. Good question, though. If you have any other questions, feel free to email or post them in the question. How we work together as a team, we look at all of you as an extension of us in our human service family. And so we encourage you to subscribe to the newsletters. We're always looking for a sense of two-way communication. So while we're trying to update you about what's going on in Indianapolis and what's going on at the federal level, we also like to hear from you about what kind of impact does this make in your local community? How are your service providers, how are your clients reacting? So sometimes ICHS volunteers from the board and will actually come around the state through regional meetings. We may or may not be having those regional meetings this summer because of our interest in really trying to focus on the candidate forums. But we do really like to hear from you. So if there's an issue that you're noticing, please let us know and we can explore if that is unique to your situation or your community, or if it is being felt throughout the state. We do maintain a lot of information on our websites and encourage you to help us with testimony, especially during the interim study committees this summer. We've provided a number of websites there of some of our key partners through this process, and then some of the other national websites, which you can see there. And lastly, I will see if there are any additional questions, and while I'm doing that, Mark, do you have any closing comments?
You've got our contact information, and certainly feel free to contact either Lucinda or I if you've got other questions or things that you have concerns about here. Feel free to contact either one of us.
Great. I'm looking one more time. I do not see any additional questions, so at this time we will close this legislative wrap-up session that was a joint effort between the Indiana Coalition for Human Services, the Indiana Association of United Ways, and the Indiana Nonprofit Resource Network, INRN, and encourage you to consider some of their local training options that are offered throughout the state in almost every single county. So again, thank you so much, and we will look forward to seeing you again at a future webinar. Thanks so much.
Thank you.